forgot to say one thing about Boston's family, and that is that the AIM actually financially was started by their generous donation. It was a set for us because donation was when Barbara was passing from cancer some years ago. But yeah, but we're here today because of it. So Ron, that's to you. All right. So I only have one topic. I've been increasingly bombarded with the questions on cannabinoids and COVID. So I kind of finally gave in and said, well, I got to talk about that. So I had to do some research. So it turns out in the last couple of months, there's been a very significant amount of interest, especially in CBD. Turned out there are multiple clinical trials that are in the way. And the reason for that is that there's been several animal models, as well as so in vitro, but also preclinical animal models showing that anti-inflammatory CBD effects. And CBD is, those of you who not familiar with the topic, it's a cannabidiol, which is a non-psychoactive part of the cannabis. And it has a pretty potent anti-inflammatory effects. And turned out that in preclinical studies, CBD have been shown to block the cytokine storm that's COVID can create. So there are several trials. I'm going to show you just one right now, real brief. Let's see how that's going to work. So I have to move. I finally got myself to get a second screen. So let's see if that, how do I do that? Like that. All right. So is that cool? All right. So this is the trial that's currently in the working. So they're looking at the CBD 300 milligrams a day versus placebo, and they're supposed to announce results very soon. There should have been 100 patients. And this is for active patients with COVID who are mild to moderately ill. How do we translate that to ourselves? It's not very clear. I think it's an interesting idea. I think that 300 milligrams a day is a realistic dosing. It's a bit high, but it's realistic, and it can be easily obtained from multiple commercial sources. So stay tuned. I have not seen more on this topic specifically, but it seems very promising, and we may hear about this more. Those of you who are already taking CBD for some other reason, I guess it could be a kind of a nice to hear, because it means that maybe you're also helping. In case you do get sick, then maybe your illness will be milder. That's how I read this. And with that, I know that there's already questions in the chat, and I'm also going to start putting questions that first came. So I'm going to do them in the order that they came in, okay? So I'm going to be putting them one at a time into a chat and then answering them as they come. And everybody else, just please feel free to put the questions in. So first question was, type 2 diabetes patients infected with COVID-19 tend to experience more severe infections. What about those with pre-diabetes? Unfortunately, this is a good question, but it points out to a complete misunderstanding of sort of what the conditions are, so to speak. I don't separate diabetes and pre-diabetes. To me, it's all the same thing. It's just a continuum of a problem. So whether somebody may have a pre-diabetes, but actually be at much higher risk than the diabetic patient if the pre-diabetes is not managed and diabetes in a given patient managed very well. So I would say it's the same exact risk factor, but of course, you know, two patients with diabetes or pre-diabetes could be dramatically different. So that, as I said, diabetic patient who is exercising, controlling their sugar really well, eating really well, and you know, has a good amount of energy and all their nutrients are balanced and everything, could be a lot safer than even an average person, by the way. So my point being is, important question, but it in short is, if you're worried about this, it means maybe you have pre-diabetes and you really need to take a look at your individual risk and do be concerned about it. So that's first. Let's move to the next question. And that is this one. So I've seen studies showing we are also at risk for more severe illness and or COVID cause diabetes to develop, but I've not seen any okay, I'm not sure what, including pre-diabetes, okay. Okay, so this is a great question. Unfortunately, and I'm not clear why that is, but no states have chosen risk based on illnesses. So you could have a brutal diabetes at the age of 50 or 45 and be very high risk, but you're going to be put in the same risk category as a completely healthy 45-year-old. So unfortunately, I have no, I can't really comment beyond that, but to me, it's crazy. I'd say that there are a lot of people with a certain comorbidities that at much younger age should be prioritized over somebody who's older but very healthy. So I can, for example, pick on Luann and say at her age, she's very healthy. And so, I mean, I'm not saying she should not be getting a vaccine, but I would say I may prioritize somebody else with the multiple comorbidities over the Luann if I only have one dose for two, because of the risk may be higher. I have personally seen multiple of my older patients without many comorbidities, and some with some do just fine, getting sick with COVID and recovering, never going to a hospital. So I think that just judging COVID severity by age was very misguided. I think it started out early on, but I wish that we would have more complex system, but we don't. Okay. All right, let's take one question from the Linda here first, and I'll go back to the questions from before. Is Moderna vaccine up to 3 times more potent on the mRNA side compared to Pfizer? I don't think so. I think there's been rumors about Moderna being more potent, but remember, the vaccine potency may be irrelevant in the sense that as long as it generates a response, protective response, it may not even matter whether the potency of a given injection compared to something else. And you all know that by now that both Moderna and Pfizer protective efficacy is about the same and over 90%. And some people, the main study even showing Pfizer slightly better, but that difference was very small. So,
could I follow up, please?
Sure.
If you already have a condition that's inflammatory, would it be safer to get the Pfizer over the Moderna?
No, there's zero data on that. Absolutely, I would say it doesn't really matter. I would say that it's much more important what kind of individual inflammatory risk is and what prep you're doing. I don't think that picking one vaccine over another makes any sense. I don't think there's any data to suggest that somehow allergic reactions are better in one versus the other. I think they're very similar. And I also don't think that the total amount of quote unquote potency is a universal thing. I think it's very individual, meaning that each person is going to have an individual response. And I don't think we can really distinguish. So plus the other bigger issues in a way is practicality. I don't think most patients, most of us will have a choice of what to get, pretty much. So generally speaking, people in larger cities or healthcare providers are probably going to be prioritized for Pfizer vaccine. And then general public or people in the more rural areas are probably going to get Moderna. And I don't think that Johnson & Johnson's going to come out really quickly. I was just told today by one of our old-time participants in this event, another Nina, that Johnson & Johnson is not quite yet clear, sort of in terms of their exact steps. So I will be following closely and I will be updating everybody on that. Okay, so I'm gonna go back to this next question that I put in. This has more to do with masks. So you all probably heard by now that Fauci has been advocating for double masking, which I actually think is a really good idea, partially because it appears that double masking comes pretty close to N95 level of protection. It's still, I would still prefer N95 for travel. Like if getting on a plane, I'd probably still wear N95. But N95s are still harder to come by and they're a bit more pricey. And by now, a lot of people have combinations of all kinds of ear loop masks. You know, I think that there's a lot of really interesting questions in this question I posted. Everybody should read it. I don't think I have every answer. I would say that the way I think about this, if the surgical mask is soiled, get rid of it. If it looks usable, no matter how long it's been that you've used it. I'd probably keep using it. I don't think that it's sort of like the material gets broken down. It will be obvious when material is starting to wear out. And of course, you need to wash the face, the clothes masks the same way you would, wash your underwear. That's how to think about it. You wouldn't want to wear your underwear for weeks at a time without washing, will you? So do us all a favor and do the same with your masks. All right, I think I gotten that one. All right, next question is, and yes, Benita clarified in private to me that it is correct. Johnson & Johnson is seeking emergency authorization, but it hasn't yet came through, and that was my mistake from prior meeting. I think I may have corrected myself already. It has not been yet approved for an emergency use. Okay, some people getting sick. Oh, sorry. I keep posting questions to default, and default is if I got a message from someone personally, it defaults sending message back to them. Some people are getting sick after second shot of the vaccine. Why is this happening, and what do you do if it should happen to you? Does the vaccine have COVID in it? Well, I'm guessing that the person who's asking this, it's a great question, but I think they were not there last time because we talked in length about what to do pre both first and second shot, but I'll go over it again in a second. So no, there is absolutely no COVID, and there's no chances of getting COVID from the vaccine. There's no chances of getting the pieces of RNA somehow built into your DNA. There is no chances of that there is a tracking devices stored in the vaccine, and now you're going to be tagged for the rest of your life and followed by government forces and whatever. I mean, all those conspiracy theories are complete nonsense. I'm sorry to disappoint you if you're one of those people who believe in them, but I would respect your right to do so. So the reason the second shot generates more side effects is pretty simple. By the time you get between the first and second shot, your body is going to develop some degree of memory. So when the second shot comes in, the body already has a memory, it already started building antibodies. It's going to have a more severe reaction, and it's completely expected. That's why we've talked last time about what can you do about it. Well, think of it this way. The reaction to the shot, if it's not a local pain in the muscle because there was an injection, the reaction is, generally speaking, a mild inflammatory response in line with a mild COVID, because that's the whole point. You want to generate antibodies that will recognize infection if it comes later after you get the shot. So the treatment, in my mind, for the side effects concentrates on two things. One is an inflammation that the vaccine generates. And that is where we talked about this product. I'm not going to mention it just to keep it clean, even though we did put it in a chat box. And if anybody interested, I can do it again. In fact, let me just do it, but I'm not going to talk about it. It's just because this product contains all of the ingredients in one. So it's quercetin, N-acetylcysteine, bromelain, and then some vitamin C. So those are some of my preferred nutrients to take for the inflammation that is started as an allergic reaction. So it's not an allergic reaction to the vaccine, don't get me wrong, but it is similar. And so the treatment, the other thing you could try, nobody knows, but some people have been trying to take antihistaminergic medications to see if it helps the symptoms. We haven't heard much success with that, but a lot of the doctors recommend for patients who had a first vaccine reaction, to take NSAIDs, non-steroidals. And so to me, the natural dehist is kind of similar to that. You could also arguably take CBD or CBDA oil, but it starts to go into territory that I don't think I want to discuss because it starts to get more complicated. And then we talked about different homeopathics, and homeopathic preparations, their role is very different, and it's quite obscure logic in the sense that if you put a substance, energetic component of the substance into your body, that somehow it will block the response that the substance at the high amount would have generated. So for example, There's this homeopathic called ledum, L-E-D-U-M, and that substance will generate response of a penetrating wound from a sting of an insect or a needle injection. But, you know, I don't want to go there. If anybody is specifically interested in individual conversation about it, you can email me and we can take it offline. I don't think it's fair for me from scientific perspective to strongly advocate for homeopathy based on science, because I don't think there is any to support it. But nonetheless, I think this is something that you would take 2 or 3 times right after the vaccine, and I believe it's reasonable given that we don't have anything better, really. Okay, so I have to go back and be mindful of time and finish with my last question that was sent to us early, and then we can go back to questions in the chat box. So once my husband and I have been vaccinated, can we have maskless indoor visit dinners with our siblings and others small, where everyone has also been vaccinated and waited for 2 weeks past the second dose for maximum protection? Okay, that's a great question. Whoever posted it's actually one of the most important questions probably today, very, very actual, since more and more of us getting vaccinated. So I would put it this way: if these people have been in close bubble with you, even though you may be masking with them, but we're thinking maybe I should slightly enlarge my bubble and include those people, then I would say that's fine. But if you have those people that are random, so they're not your relatives, they're not your friends, they're not somebody, I would absolutely say no. You should continue to use masks because the bubbles are going to start getting gradually increased as we keep moving, our social distancing bubbles. But I would discourage us from making this bubble go from this to that a couple of weeks after the vaccine. Unfortunately, there's one big unknown. And that big unknown is this, is the vaccine going to stop the spread? And nobody can answer that with a certainty, and that's very unfortunate. And we know for sure that vaccine decreases symptoms. We know for sure that it has some protective role for morbidity and mortality. But we don't know 100% sure yet that vaccine will stop the spread. And thus, we have to continue every single social distancing measure, at least until we have additional data that somehow disproves what I just said. Okay, all right. So let me go back, and I think we're going to be right on time. So I don't know if I missed anything on top above. All right, I covered that. Yeah, so CBD contaminated, very good, good point. Again, that's not for today, but you absolutely must work with somebody who knows something about the topic. You cannot just buy CBD online. Unfortunately, a good percent of it is contaminated. Again, I can't just give you my favorite brands here. I don't feel comfortable doing that since this is a public, you know, I'm not really endorsing any specific products here, but feel free to contact me individually, okay? All right, in the experiment, in what form? CBD, in very good question, Salome, thank you. So in that trial that I was showing, I believe that they're doing it as a sublingual tincture. Let me double check real quick. It's a sublingual form given in medium coconut chain triglyceride oil, which is an extract of coconut oil, it's MCT oil. And it's given as a 1 milliliter under the tongue. So that's a very common sublingual route. Most of what I recommend for my patients is this type of administration, but 300 milligrams a day is a pretty high dose. Usually I start most of my patients somewhere between 15 to 50 milligrams a day. So this dose is much higher than that. All right. Judy is asking me personally, J&J vaccine, Johnson & Johnson, can it be used for people over 65? Will it come without preservatives? No, I'm pretty sure, Judy, it will come with preservatives. I'm pretty sure it's going to have a mercury. I'm pretty sure it's going to have other preservatives. So remember, you may have heard me say this, but I'm guessing, and I can't be sure, but I'm guessing that Moderna and Pfizer vaccines from the perspective of preservatives are going to be the safest because they kept at the super low temperatures and they only use PEG which is probably the safer preservative for most of us. Okay. Okay. All right. The person who asked the mask question, I'm not exactly sure if I answered that question to the person's satisfaction. If you know who you are and the question's in the box, feel free to unmute yourself if you're comfortable and clarify what's not clear. I'm just realizing I'm rereading this question and I realize maybe I didn't answer this well. All right. Okay, okay, there's some chat going on. Some have suggested taking chlorella to reduce vaccine reaction severity. I'm not sure what this gets at. Chlorella is used as a detoxifying agent. I have no idea why would you do that here. There is no toxins here per se. I wouldn't do it. I would concentrate on an anti-inflammatories and maybe on kind of basic symptom support, you know, antipyretics, for example. But yeah, chlorella doesn't make sense to me. I mean, I guess you can think of it this way. Some people said, look, maybe I should do a sauna after the vaccine. Sure. I mean, you could do a variety of things that potentially induces a placebo effect or helping you to kind of get over the symptoms of the vaccines that you know work for you personally. If that's the case, then you know your body better than I can ever explain, and then there's nothing wrong with that. Not that chlorella is a part of the food chain, so there's no problem taking that. All right. All right, what should we take if we have symptoms? Well, I just explained that, so I don't know if I should say it again. So my protocol for the supplements for that, if you're taking the, let's say, quercetin preparation, that take a good dose 3 times a day, 24 hours before, and continue for 2 or 3 days after the vaccine until all the symptoms go away. All right,
Misha, could you answer the last question from Cecile, and then let's move on to the mind-body portion.
Perfect. I am a mask Q person. I want to know about rotating the masks if you're double masking the blue masks, or do you treat the pair as one mask? I don't think I understand this.
Cecile, can you unmute yourself and ask Dr. Kogan your question?
Hi. So I've got 2 blue, I guess the paper mask, the surgical mask, and I wear one inside of the other. Can I switch them around?
Sure.
To having the one that was exposed to the outside air now.
Okay, all right, so let me clarify this. There is no point to worry about saturation of those masks. That's not how they work. If they are intact, they're gonna keep protecting you and others. You just don't want them to be soiled or moist. So if your breath is in the cold, soils the mask, or saturates it with water, then it's gonna be less efficient. You need to dry it up. But I don't think there's a reason to throw them out after a couple of use. At least I have not seen anybody advocating for that. You need to keep them, you need to keep looking at them. And if they look that their structure is intact, they're probably still nearly as good as when you started using them. It's a bit more complicated with N95s, but even N95s, I'd use the same principle.
Okay, so do I assume if I got the mask wet inside on a cold day that, so it's soiled now, can I move it to the outside?
Yeah.
One is the other one?
Yep, you just switch them places, then let them dry up. And so, you know, and then reuse them again when they dry up.
That sounds good to me. Thank you.
Right. I have 30 questions to answer the iodine question. Absolutely not. Do not put anything on the mask for any reason under any circumstances. The silver you're going to put on the mask is going to destroy the mask, so will the iodine. If you are researching silver or copper containing masks, those of you who've seen me answer this question on Washington Post a couple of days ago, yeah, you could totally try the silver or copper containing masks, but those masks are made with silver and copper as a part of the mesh of the mask, but do not put any of that on the mask. That is really not a right thing to do. And I think with that, thank you. And Nina, do you want to step in, and floor is all yours. And of course, everybody know Nina Paul by now. She's been coming to this class on a regular basis, and we are absolutely glad and happy to have her back.
Thank you. And it's great to be here with everyone. Happy Friday. And I'm looking forward to our mind-body session now. So we're going to start the meditation practice today with mindful breathing. And with mindful breathing, that will give us a few minutes to welcome ourselves, our mind, our body into the present moment with a kind and welcoming attitude as we connect with the presence and our mind and our body. And then after that meditation, I'm going to introduce you to a different technique for reducing stress. And it's called emotional freedom technique, more popularly known as tapping. And the reason I use tapping is because I have found it to be highly effective for when I'm really stressed out by something or really freaked out. And I need a way to more rapidly reduce my stress response and reduce the intensity of my negative emotions like overwhelm or worry, anxiety, whatever it is. And so that's what tapping is all about. The main objective of it is to reduce the intensity of negative and difficult emotions so that when you get really worried or stressed or overwhelmed and you find you can't get out of the grips of it, you feel stuck. Tapping is what really helps with that because it will reduce the intensity of negative emotions so that you can think more clearly and feel more balanced and at ease. So we'll do tapping after the meditation. So let's start with our mindful breathing meditation now. So go ahead and get into your mindfulness posture. You could be sitting in an upright posture on a chair or lying down, whatever is most comfortable for you. You want to be relaxed, comfortable, and alert. So you can close your eyes or have a soft gaze downward at a fixed spot in front of your feet. And you can put your hands on your lap with your palms facing upwards or downwards. And we'll start the meditation by taking a few deep, calming breaths. So let's take a deep breath in through the nose and a long, slow out breath out through the mouth, letting go and releasing on the out breaths. Let's take another deep breath in. Long, slow, deep breath out. Let it all go. Another deep breath in. Deep breath out. Relaxing and releasing on the out breath. And then returning to the natural rhythm of your own breathing when you're ready. Take a moment here to welcome yourself as you are in this moment, moment to moment, bringing an affectionate attention to all that is arising, all that you're noticing coming up into your awareness. You can feel your whole body sitting here breathing. And Now you can sense into your body, noticing your feet making contact with the floor, your legs making contact with the chair or the floor, the cushion. You might notice your back making contact with the back of the chair or the floor. And then take your attention up to your shoulders. Typically hold tension in the shoulders. You can take a deep breath in, a deep breath out, relaxing and releasing the shoulders on the out breath. Softening the shoulders as best you can. And then bringing awareness up to the face, softening and relaxing the jaw. Letting the tongue go loose in the mouth. Softening the cheeks, the eyes, the eyelids. And easing attention up to the forehead, softening and releasing here as you're breathing. Now just feeling into your entire body, sitting here breathing, moment to moment. You can anchor your attention on your breath, either at the belly or the chest. Just feeling the movement of the breath as the belly or the chest rises and falls on each in and out breath. So for a couple of moments now, we'll simply focus on our breath in this way, moment to moment, breath by breath. Pretty quickly on, you'll notice your mind wandering off from the breath. That's perfectly normal. Nothing has gone wrong. Once you notice that, you can gently just label that silently as thinking, or wandering. And then return your attention kindly back to the breath. Each time you notice it's wandered off. That's the essence of the practice. And now you can bring the meditation to a close when you're ready. Just take a deep breath in, deep breath out. Gently open your eyes if they were closed and come back into the room. Wonderful job. You can stretch here, move around. Whatever you need to do to orient yourself back into the room. And so we'll move right into our tapping practice. So there's a few things I'm going to tell you about tapping, and then I'll show you the tapping points, and then we'll do the practice. So tapping is an evidence-based practice for stress reduction. It's well researched in the veteran population and found to be effective for veterans who have PTSD and other trauma issues. So research into tapping is well funded and continues to be studied today by major academic and health institutions. So how do you do tapping? So tapping involves actually tapping on our acupressure points with your fingertips, and we'll go over the points in just a second here, while you're talking about your stress or feeling stressful emotions that are coming up. And those stress statements are combined with a positive affirmation type statements that's accepting and kind and compassionate, all the while you're tapping. And so by doing this combination of practices where you're talking about your stress, you're bringing in acceptance and compassionate statements, and tapping on your meridian points, your acupuncture points, causes a reduction in the intensity of the emotion, causes your stress response to calm down. And typically after doing a few rounds of tapping, you'll notice your body feels more at ease, a bit more relaxed, and you think about your stressor and you'll notice, wow, I can think about this stress and yet I feel calmer while I'm thinking about it. And you might have a new perspective on it because you can think more clearly. And so you can practice tapping in two different ways. You can tap for a specific problem that you're having, or you can tap for general stress and anxiety. And today, here, we're going to practice tapping for general stress and anxiety. And so, as I'm guiding you through the tapping, if the words I say, for example, if I am saying feelings of overwhelm, feelings of worry, but you're actually feeling frustration or anger, it doesn't matter because you are still going to get the effect of stress reduction. And also, the main thing is just try to tune into your negative feelings, to your stress as we're tapping, because you want to call up those stressful emotions, those negative feelings. By calling them up and then doing the other two parts, that's how you're going to be able to release those emotions and reduce their intensity. And finally, tapping is very forgiving. You don't have to be tapping on the exact right spot or say the exact right word. You're still going to get the effect of stress reduction. And if by chance we do some tapping rounds and you're still not feeling it, feeling some release, then you just keep tapping, you keep doing more rounds, and there'll be plenty of resources for you to access after this session where you can do more with it on your own. And now we'll move to the points. So we start at this, and everybody just go ahead and start tapping with me as I'm showing you the points. So we start on the side of the hand, so that's underneath the pinky on the side of the hand. And you take your other hand, 4 fingers, and you tap here. I'm seeing some of your faces tapping, and you got it. And then we'll go to the top of the head. So the middle part of the top of the head. But again, like I said, don't worry too much if you're not on that exact right point. And so you want to tap gently, but you don't want to tap too gently that you can't feel it. You want to kind of feel that vibration, that impact. But I don't want you to tap too hard that you're hurting yourself. And then we'll move to the facial points. So the start of the eyebrow here on the bony part. Side of the eye on the bony part here, the outside part of that eyebrow. Feel the bony part. And then underneath the eyes on the bony part. Underneath the nose. Underneath the lips, the indentation point of the chin. And you could be tapping just on one side. You don't have to, use both hands all the time. We've got 2 more points. So we're going to go to the collarbone point. So basically come down to that notch in your neck where you feel that U-shaped bone. And then go down about 1 inch and to the sides about 1 inch. So you're underneath the collarbone and there's kind of like a fleshy point there. And you can tap with one hand or both with your 4 fingers. And then finally, underneath the arm. So about 2-3 inches underneath the armpit. I know this looks kind of funny. Okay. All right. So let's get started. And what we're going to do, is we're going to start on the karate chop point, and I will say a statement and you'll repeat it after me silently to yourself. We're all on mute so you could say it out loud, but let's just stick with silently to yourself. And I'm going to pause after each statement, so it'll give you a chance to repeat it to yourself. And I will let you know what points we're on so that you don't have to keep your eyes open if you don't want to. But if you want to keep them open, that's fine too. And really the most important point here is just try to tune into your feelings of general stress or general anxiety that you're carrying. Okay, here we go. Even though I'm feeling stressed, I deeply and completely accept myself. So we're on the karate chop point. Even though I'm feeling some anxiety, I honor how I feel. Even though I feel worried sometimes, I accept how I feel and am open to more ease. Now the top of the head, feeling this anxiety. Eyebrow, this stress. Side of the eye, this worry. Under the eye, it can be hard to let this go. Under the nose, in the face of these feelings. Chin, it can be hard to relax. Collarbone, I feel the weight of this emotion, these emotions. Under the arm, and I feel them in my body. top of the head. Sometimes it's frustrating. Eyebrow, with everything that's going on. Side of the eye. I'm ready to be done with this. Under the eyes, but it's hard to let it go. Nose, feeling the stress. Chin, the anxiety. The worry. Collarbone, under the collarbone. Take a deep breath in and out. So we're taking a pause, just tuning into your mind and body, noticing how you're feeling. We'll do one more round of tapping on these feelings, and then I'll close it out with the positive statements. Under the arm, still feeling some stress. Top of the head, some anxiety. Eyebrow, some tension. Side of the eye, can still feel it in my body. Under the eye, feeling the stress. Nose, the anxiety. Chin, the worry. Collarbone, ready to let this go. Okay, I'm going to close it out now with some positive statements. I may be skipping points, and that's okay. So under the arm, it's safe to release this stress. Deep breath in and out. Top of the head, right here, right now. Eyebrow, it's safe to relax. Outside of the eye, in the face of this stress. Under the eyes, I am open. Chin to letting this go. Collarbone, and resolving. Under the arm, in due time. Top of the head, I'm releasing this stress. Under the eyes, right here, right now. Collarbone, letting go of this stress. Under the arm, the best I can. And finally, top of the head, it's safe to relax in the midst of this stress that comes and goes. Okay, so take a deep breath in and a deep breath out. You can shake your body, like let out all of that tension. And take a moment now to drop into your mind, your body, your mindfulness posture. Notice how you're feeling. Do you feel any release of tension? How does your body feel differently? And if you still kind of don't feel that release, or you're still holding tension, that's perfectly fine. You would just do more rounds of tapping before you close out with positive statements. And I'm going to give Janet links to many resources on tapping so that you can practice on your own. And if anybody has any questions, just let me know. I'll also provide my email if you want to email me, and I think Dr. Kogan might want to finish answering questions, so just leave it up to him, you guys. Thank you.
Thank you, Nina. This was wonderful. Thank you so much. I kind of wonder, I don't want to do questions after this. It's too relaxed. And I don't really see anything very urgent, but maybe we can hear a few people give us the feedback on how they're feeling now.
Oh, I see a question here.
Okay.
I love, oh boy, occasionally during meditation, I wind up taking a deep breath, which turns into a yawn. Is that okay? Absolutely, because when you're meditating or when you're tapping, your body can start to relax and release, and it typically it can get kind of drowsy and tired. So yawning, eyes watering, nose running, those are all releases. So it's all fine and welcome. And it's a good sign your body's relaxing.
Yeah. Yeah. I think the body often sends us the messages that it's more tired than we give it a let in, and sometimes that's a simply message that we need to rest, and the short practices like this could drop us into a much deeper relaxed state when symptoms surface of something that we have not done enough of. So I think yawning and even falling asleep during the practice is probably completely appropriate. Okay, there's one question that I actually think is very good, and I want to try to answer it, although I'm not sure I can perfectly answer it, but I'll try. So it's after I'm vaccinated and I have waited for the requisite time period, would it be safe to fly to the East Coast, then quarantine for 14 days, and then visit my children who have been practicing safety precautions by asking and have a small pod of people they connected with on a regular basis? I would say absolutely yes. The way the question is written, not only this person would be vaccinated, so their personal risk is going to be lower, but they're also going to quarantine themselves for 14 days. So they will be protecting their children, grandchildren. So I would say yes. And I think also this means that the risk of you who posed the question is probably going to be pretty low in this situation if you gotten both vaccines and waited for sort of 2 to 4 weeks at least after the second vaccine. So I say this is okay. Yeah, especially I would say probably quarantining is a critical piece there, because you don't want to bring stuff on the plane back to them with you, because remember, we don't know if the vaccine stops the spread, meaning we don't know if you can still pick up and carry the virus even though you've been vaccinated. And I think with that, we have a couple of minutes. If anybody have any kind of a last moment shout out, or there's another question, right? Anywhere else to tap that would be less noticeable to the people you're near? Nina, do you want to answer?
Yeah. So if you're sitting on a table, you could be just tapping underneath the table, just tapping here like this. And yeah, I mean, when you get really good at tapping, you can imagine tapping just in your mind, but that takes a long time of practice. So I would say here, there's another tapping point in between the bottom of the pinky and the ring finger. There's an indentation point. It's called the gamut point. You could tap there, and even take your 4 fingers, squeeze, and then underneath squeeze with your thumb. That relaxes me pretty quickly, that point right there, the gamut point. So you could be just pressing there. And I'm trying to think, I guess that's it. You wouldn't, sometimes I even tap here in front of people. I don't really care sometimes. I'll be talking to my daughter on the phone, and if it gets stressful, I start tapping here, and she says, "I can hear you tapping, Mom." So You can get creative with it. So that's a good question.
All right. Well, I think it's at 3 o'clock. Everybody have a great weekend. Just to want to mention what Janet put in the chat, that next week we're going to have Patricia Fry back. Patricia is our local practitioner, integrative functional and cannabis medicine. And then Eileen Yeager, who is a practicing pediatrician and mind-body physician in University of Colorado. So she's going to be participating from afar. I will try to join, but officially I'm on vacation, so I will do my best, but I may prioritize kids, and I hope everybody will forgive me for that. And with that, it's gorgeous outside. I hope you all get out and it's not as cold today in our area. Those of you who are elsewhere, enjoy your weather no matter what it brings.
Now, Misha, before we let everybody go, I'd just like to make another announcement. Dr. Jim Gordon, who is the founder of the Center for Mind-Body Medicine here in DC, he's a pioneer in mind-body medicine, period. And he is going to be doing the wellness talk and the mind-body practice on February 19th. So spread the word, make sure when I send out the link for that date that you're registered, and I will turn things back over to Misha.
Yeah, I'm very excited. Jim has been long-term mentor, now more like a colleague. It's very exciting that I now work with people who used to be my mentors. So it's very, very exciting. So with that, everybody stay safe, get your vaccines, don't overthink it, do the basic prep, and we'll see you soon.
And we have the name again.
Dr. Kogan, see my